Hello, this is my developmental presentation. I had the age infant, which is 0 to 24 months. Who am I interviewing? Let's see.
I'm a mom of 4 kids.
That are like how old?
I'm the mom of 4 kids. They are 17, 15, 5, and 7. I have to think about that.
Okay. It's my mom. She's raised amazing daughters, as you can tell. And she's seen everything as a parent, I believe, especially just raising 2 younger ones. Yeah. Okay, so I'm going to be talking about 3 theories today, and we're going to start with Erikson's theory. He has 2 theories in the birth to 24-month stage, starting with birth to 12 months, which is trust versus mistrust. And babies either trust that others will satisfy their basic needs, nourishment, warmth, cleanliness, and physical contact, or will develop mistrust about the care they have received from their guardian. The next is 12 months to 36, and that's autonomy versus shame and doubt. The child will either become independent and want to try new things, or including but not limited to feeding, walking, exploring, and talking. Is hopefully the guarantee in those kind of things. So I did ask my mom this question right before the next thing that we're going to see, and it's what are the basic needs of an infant. These are just kind of a few of them: feeding, clothing, clean diaper, child-proof environment, just making sure your child is safe at the place they're living. And here's that clip.
Good. Did you say that you provided your children all of these things?
Absolutely.
I would agree. Would you say you had a child-proof environment for your kids? Like corners of tables, not little things?
I would say yes to a certain extent. Anything that would harm them in a way that was catastrophic, we had protections in place. So we had outlet covers, we had door handle lock things so they couldn't get into cabinets with chemicals. We had our medications up high. We didn't have little toys for choking hazard. But I would also say that we maybe had some furniture that had corner edges, but we taught them to be careful around them. Or we had stools that you could sit on. We taught them not to stand on stools. So we kept it to a limit.
Okay. Again, the child needs to feel safe in their environment, or studies have shown that they will later show resentment towards their caregiver. I did also ask my mom if she thinks that all of our kids have felt safe in where they've left and not causing them to have long-term effects on it, and she agreed, and I would agree with her. Why is this so important? Again, having somebody you can trust in really just helps you set yourself right for forward relationships. Okay, the next stage is autonomy versus shame and doubt, which is the 12 to 36 months. The child wants to start stepping in and helping mom or dad. They start to gain their independence, which is really important. I asked my mom a couple more questions about if she would let them help make dinner, if they would be able to dress themselves, starting to take in those steps. And she would say yes, but if obviously we're on a time crunch, probably not. Okay, the next person we're going to talk about is Freud. He again had 2 stages just like Erikson. We're going to start off with the oral stage, birth to 12 months. The lip, tongue, and gums are the main focus of the child, and the child starts sucking and feeding become a main activity. So a couple questions I asked my mom was, before the age of 1, would you say your child starts sucking, biting, and chewing on various objects? And these were her answers to that.
Age of 1, would you say your children like to suck, bite, chew on various objects?
Of course, every little one does.
Okay, did they love putting things in their mouth?
Yes.
Okay.
And we let them because germs are good.
Not my microbiology class wouldn't say.
Okay. Again, all of those. The next is about thumb sucking. So we're a family known for our thumb sucking. My sisters and I all did it. I stopped at the age of 5. I think my second to youngest sister stopped at the age of 10, 11. And I read up on it, and the child is in need of oral fixation. Children are born with sucking reflexes and will turn into sucking their thumb with discomfort. It's self-soothing. I think a main problem of it was when we're bored about to fall asleep. Would be a big time when we put our thumb in our mouth. But we did eventually go away from that because it will cause problems later on, and my sister is now having to wear Invisalign because of that. Okay, and what did Freud believe? Freud believed that the experience during the oral stage can be influential to the personality development. And I asked my mom if children would be envious or optimistic, full of aspiration. Children who get sucked in the oral stage are more likely to engage in eating, smoking, nail biting, and thumb sucking, which we talked about. Okay, Freud's anal stage.
Yeah, so I have potty training down. I've mastered that. Let me tell you all how to do this. Wait until they're 3 and they want to, and then do it in 1 week. Boom, done.
So in that video, like my mom says, she thinks she has it down to a T, but in reality, I think my sister and I basically potty trained the 2 younger ones during the COVID stuff. But anyways, Freud's anal stage is 12 months to 36 months, and the children take pleasure in using the toilet. There's 2 kind of personalities when it comes to the toilet, and that's the anal retentive personality and the anal explosive personality. Okay, and then we have Pigot's theory, Jean Pigot, and he says how people think change with maturation and experience, and then their thinking influences not only how they think, but also what they do, and I will change that to a but. What is the sensory motor stage? The stage is only one stage this time. It's birth to 24 months, which is rapid cognitive growth happens, and the child learns sensory experience with and manipulating objects, and they start to begin object performance. At age 18 to 24 months, the child should start to understand peekaboo, cause and effect, logic, and pretend play. Here's kind of a clip from that.
You say that your children love to like pretend play.
Yes.
Yes. Like using banana as a phone, dolls getting names.
Oh, totally. All of them. Some of them needed to play with somebody. Kylie, you always had to play with somebody, but the other ones were very good at self-play. Seems like the oldest child. Very creative. Yeah.
Basically, just talking about.
My message title is.
Just talking about how we as kids are kind of following Pigot's theory, and we loved playing. She did say later on in the video that because I was more of a I want to play with others kind of people, my imagination might have gone down a couple levels compared to my sisters, but that's okay. Overall, I think for the most part, our children have followed or have had similar experiences to these developmental theories. Other than the toilet training one, and my mom commented in the interview, she said that my sister, Lily, who is very sophisticated in the things that she wants, she'd also spend a lot of time on the toilet just sitting there, which is kind of controversial in that theory. Freud's theory, anal stage, and I would have loved to experiment on a child to truly understand all these kind of things and test him, but I just wasn't given that opportunity, but really thankful that my mom could help me out on this. And yep, the next slide is just my interview with my mom.